to getting any positive homozygous. Now, I know, the test is very new, so you're going to have some positive homozygous now, but 6 months from now, there really should be very few cases that we accidentally get a positive homozygous, because even if you choose to breed your fabulous positive homozygous dog because he's the end of the line and very important, as long as you breed to a negative, they're going to be positive heterozygous. Right now, when they're positive homozygous, you can tell them that it's very new, and so you had no way of preventing this. There are factors that seem to affect whether the dog will develop the severe disease, referring to penetrance, and those are being investigated, but this is a dog that should be followed very closely. After diagnosis, would an implanted defibrillator have a value in preventing sudden death, especially in young dogs? I actually don't think so. The problem with the defibrillators is they've been planted in a few dogs so far, but right now they are really set up for human beings. And I know of at least one dog where, because they're set up for human beings, when a dog runs or plays, the heart rate goes up enough that the defibrillator goes off. And if they go off, it's extremely, excruciatingly painful. And we had one dog where the owners begged us to turn it off because the dog was in such pain. In human beings with those defibrillators, people have a higher rate of depression because they walk around worried about when that next stunning electrical defibrillation is going to fire. So I believe that antiarrhythmic drugs like mixilotine and sotalol are very useful if a dog has ventricular premature beats. I don't believe, unless a company actually decides to make defibrillators for dogs, that they're a safe thing for dogs right now. It's almost cruel when you see the pain they go through when that thing goes off unexpectedly just because they were out playing in the yard, not even having abnormal heartbeats. It goes off just when they're running through the yard because it doesn't know that a dog can have a fast heart rate when it's exercising. So this question is, if you have a positive homozygous dog that has lived to be 10 and is asymptomatic, and maybe you've echoed it and Holter monitored it, but it's 10 and has no signs, and you breed that to a negative dog, is it possible you're even doing a good thing? Because it might be that here's a positive homozygous dog that has a very low penetrant form of the disease, and it's possible that there are genetic modifiers out there that might be being inherited with that. So we don't know. It's not by any means a bad question or a crazy question. I think that it's easier to make that decision, I think, with a positive heterozygous, because then not only do you know it likely has low penetrance, but you're definitely, going to have, you would hope to have some puppies that don't pass on that don't have the mutation. It's a little harder with a positive homozygous because you're definitely passing on the mutation for at least one more generation. But I think your point about it being a low penetrant dog that might have genetic modifiers that make it low penetrant is a valid one. And so what I would say is, if that is a fabulous dog in other ways, it's not a borderline dog, there are lots of phenomenal things about the dog that also help you justify keeping it, then I don't think that's a crazy decision. I mean, I really think we use these tests as tools for you to guide your breeding program, which you know best about because you guys have been doing it for a decade or longer or whatever in your particular family. So test so you have that information. Now you have that information, and you can gradually, with time, move away from it. But use it as just that, information for you to use with the information you individually know. So here's a summary, and I'll just read it out loud, and then I did want to spend 1 minute on therapy because I promised somebody I would. To summarize, it's important for you to continue to send us your annual echo and ECG results as a follow-up on the genetic results. And that'll be very helpful. Blood samples are preferred. Blood samples are really only preferred, are really only necessary if the dog is negative and the dog is affected. Otherwise, a swab is just fine. And I know it's cheaper for many folks to just do a swab. You don't have to go to the veterinarian. And with a puppy, it's easier. Swabs are just fine. But if the dog is negative for the mutation and positive for the disease, it would be very helpful if you could either go ahead and send us a blood sample, or we could send you, we could ask you to get a blood sample. I've had people ask if I can pay the veterinarian fee, because sometimes it's $30 or $40 to get the blood sample. I just can't. We really don't have research funding to do that right now. So I know it costs you folks to do it, and if you don't have the money, that's okay. You know, we understand that. But we actually don't have money either that we can pay a veterinarian to collect those samples. It's a problem. What do I think about breeding a positive het to a positive het? I think it's less ideal because your risk will be a little bit higher. Instead of having a 50% chance that you'll get a negative, you only have a 25% chance that you'll get a negative. So if the circumstances are such that this is the best mating you can possibly get, okay, I mean, you should still, hopefully you'll get some negatives from that. But it's less ideal. In an ideal world, I would do positive het to a negative. Is it possible that this knowledge about PDK will lead to specific development of drugs to treat affected dogs? Yes. And I think it's also possible that this information will lead to potentially changes in diets for affected dogs, maybe even dogs that have the mutation and aren't yet showing any signs. Maybe we'll come back and say we switch to a different diet. I think it's also very possible that it gives us specific recommendations about exercise. So I think it is very likely that we will adapt this information to that. If the dog has dilation already, so it's starting to dilate its heart, if the heart is big, it should be on a drug called enalapril. Or in our practice, that's generally what we would do. If the heart has already poor function, we add pimabendin. And if the dog has ventricular premature beats, we would use another drug called sotalol or mexilitine. But I do think that starting the dog on these drugs before they've gone into heart failure does help them. Is there a way you can donate directly to the project? Absolutely. You make the checks out to WSU Foundation, just so it does. I mean, sometimes when people see the giving page, they think that money's just going to get lost in the foundation. If you make the check out to WSU Foundation and you send it to me, to the our swab service, any of those addresses that are there, and write, this is for Doberman Pinscher research, I give it to the WSU Foundation and they put it in our specific account just for this research. You can also, if you go to our web page, there's a Give Now button if you want to do it on a credit card. All of that money goes directly into this research. We don't take any of it. The university may take a 2% or something for handling charges over all the donations we get, but any donations, $5 donation is a very helpful thing to us. This question was, if there are potentially other modifiers in there that are having an impact, we don't want to panic and rule out all carriers for the future. That is correct. Some of the carriers will never show the disease and may actually contain protecting genes. But in an ideal world, we know that the gene itself is not protectant, but those dogs may have good genes with them. So we want to slowly get rid of the bad gene and hang on to their other good genes. We do that by breeding to a negative and then gradually over a generation or two selecting puppies from those litters that are negative to replace as breeding animals. So we know the gene is bad, but those dogs probably have good genes as well that we want to keep in there. Do I have a sense of the percentage of dogs that are heterozygous or positive homozygous that will be diagnosed with dilated cardiomyopathy? I don't know. The mutation has an incredibly high statistical correlation to the development of the disease. But because of the tremendous variability in penetrance, that may be diet, could be pollution, could be exercise. So even between a few out there, person A living in Washington and person B living in Ohio, you may have two litter mates that are both positive homozygous. It's even possible that something in the environment or what you do with that dog, maybe person A goes running, person B lets the dog, that dog has a less exercise exercise life, that they both have the mutation, that what you guys individually do may have something to do with the penetrance. Now, we don't know what those factors are, so it's nothing you can do right now, but it's why it is so hard to predict what percentage of positive homozygous or negative will show the disease. And again, I stress, because I know people get frustrated by this, and then they want to say, oh, then it's worthless. This is the exact same information they would tell you as a human being if you have one of the dilated cardiomyopathy mutations. And when you look at human research, they have a lot more money to study this than we do. And so we're starting from behind. We're trying to catch up with them. But they haven't answered that question yet. So we're going to do our best, and maybe because PDK is affected by diet and exercise, we may have information sooner. But those are unanswered questions. Will gene therapy be a possible treatment in the near future? Maybe. I think sooner than gene therapy will be Dr. Estrada's stem cell work, and they're actually trying to think about trying to put this particular gene in with the stem cells. So I think that's more like, that may be the newer or sooner thing. And there was one last question about, is there any drug I would not give a Doberman Pinscher? There's not really. I'm a little careful with digoxin these days. I'll just write that, because we really don't need it very much anymore, and it seems to give Dobermans, a fair amount of nausea. But otherwise, most Dobermans are very comfortable with most heart drugs. So I really appreciate that. It's been a phenomenal audience. We've had some excellent questions. I really appreciate your time today. I know it's a confusing topic. I know you have a lot of questions that I wish I had yes or no answers for, and I hope that in the near future we'll get there. Maybe we'll do another one of these webinars in a few months, and we can give you an update at that point, because we really enjoy it as a chance to communicate with you. Feel free to email me at any time you thought your test results were wrong, your dog was negative but it's positive, disease-wise, you have questions.